everyone. It's 4 o'clock in the East, an unwelcome new designation for the United States. We are now #1 in terms of known coronavirus cases, surpassing China at 91,000 and rising. The majority of those cases remain in New York, with more than 45,000 statewide, most of them in the New York City area. But hotspots are emerging in New Orleans, Chicago, and Detroit, to name just a few. Shouldering the burden of the rapidly increasing spread, the first responders and healthcare workers on the front lines. The Boston Globe reports today that more than 160 hospital workers have tested positive for coronavirus at Boston hospitals. That's along with more than 350 police officers with the NYPD and more than 200 New York firefighters. Governors in some of the most heavily impacted areas are filling the leadership vacuum created by Donald Trump's uneven response to the crisis and his ongoing refusal to use the Defense Production Act to surge resources to increasingly overwhelmed hospitals. And instead of pledging limitless support to first responders and those hospitals impacted first and most dramatically, the president and his task force members are taking a surprising approach. They're actually questioning the anecdotes and stories of panic and shortages emerging from New York hospitals.
We were reassured and meeting with our colleagues in New York that there are still ICU beds remaining, and there's still significant over 1,000 or 2,000 ventilators that have not been utilized yet. To say that to the American people, to make the implication that when they need a hospital bed, it's not going to be there, or when they need that ventilator, it's not going to be there. We don't have an evidence of that right now.
Those remarks don't square, though, with another new report. This one from today's Washington Post on acute shortages of masks, test kits, and ventilators nationwide. And as New York Governor Andrew Cuomo has taken to issuing daily public appeals for the 30,000 to 40,000 ventilators he said his state needs, President Trump took to his favorite TV network last night to cast more doubt on those numbers.
I have a feeling that a lot of the numbers that are being said in some areas are just bigger than they're going to be. I don't believe you need 40,000 or 30,000 ventilators. You know, you go into major hospitals sometimes, they'll have 2 ventilators, and now all of a sudden they're saying, can we order 30,000 ventilators?
Governor Cuomo responding this morning in his daily press conference that unlike the president, who's famously and publicly bragged about trusting his gut and his brain more than the experts, he's just relying on data.
All the projections say you could have an apex needing 140,000 beds and about 40,000 ventilators. Those are numbers, Zach. Not I feel, I think, I believe, I want to believe. Make the decisions based on the data and the science, and we're following the data and the science, and that's what the data and the science says. I hope we don't need 30,000 ventilators. I hope some natural weather change happens overnight and kills the virus globally. That's what I hope. But that's my hope. That's my emotion. That's my thought. The numbers say you may need 30,000.
Decisions based on science and data. Wouldn't that be nice? And we should note we're watching the White House, where any minute the president is expected to sign the coronavirus relief bill just passed in the House, a measure the millions of Americans laid off over the coronavirus shutdowns have been desperately waiting for. We'll bring you that event once it gets underway. But first, the ominous headlines on the spread of the virus across the U.S. with some of our favorite reporters and friends. White House reporter for the Washington Post, Ashley Parker, and former Obama White House health policy advisor, Dr. Zeke Emanuel. Dr. Emanuel, first, just put this issue to rest. The numbers about the respirators needed by the cities that are actually filling up and setting up morgues outside their doors, those are numbers based on scientific modeling, right?
Well, absolutely. The idea that a major hospital in New York would have 2 ventilators, as the president claimed, is just a joke. It belies credulity. I mean, it's just wrong. And I think the 30,000 number is not for a particular hospital. It's for New York State hospitals across the whole state. And even in New York City, I mean, you've got 9 million people in New York City. And, you know, they are by all reports, my talking to frontline doctors this morning, they are literally overwhelmed. The New York Times had this unbelievably moving and horrific picture from Elmhurst Hospital. I mean, you've got real demand here, and the 30,000 is based on a projection at the maximum. We're not at the maximum yet. We're still going up day to day. And so it's not an unreasonable say, I'm not going to ask you for what I need today. I'm going to ask you for what I think I'm going to need when it's the worst it's going to be. And the president doesn't seem to be engaging in that.
Dr. Emanuel, Bill de Blasio, New York City mayor, said today that half the city could become infected. What does that look like? Mayhem,
pandemonium, and a complete breakdown of the healthcare system. So if half the city, that's 4.5 million people, get infected, the first thing to recognize, that probably means 45,000, 50,000 New Yorkers die from this virus. And if 5% need hospital and intensive hospital care, 5% of 5 million is 250,000 people. There aren't enough beds in New York City for that. You know, just point blank, simple, done. That's a quarter, more than a quarter of all the beds in the entire country. So, you know, I don't know what you do with that.
Dr. Emanuel, you made policy for a president in the Obama White House, the Obama administration. Can you just explain how a policy process can result in the president not invoking the Defense Production Act to make, heaven forbid, enough ventilators for that scenario to play out that Mayor de Blasio cautioned of today?
Well, I'm not sure what the thinking is in the White House. And I don't think it's unreasonable for the president to say, listen, GM can run its factory better than we can as the federal government run it, and we can negotiate with them about converting the production lines off of cars onto ventilators. And you saw GM said yes, they gave a bill of $1 billion for 80,000 ventilators, roughly $12,000 a ventilator. I haven't been in the market for a ventilator, so I don't know, but I would think that a ventilator is probably $5,000 or $6,000, but they have to pay to retool that production line. And I assume that's where the expense really comes in. And if we're interested in it, maybe the government just gives them the money to retool that production line to keep the supply chain open. And you know, similarly, you want to do it with all the other things you need, like PPE, like masks, like goggles. And I just think, you know, I think threatening to take over is probably good negotiating. And so I don't think that's where the rub is. I think the rub is that we don't have an organized assessment of, we're going to get 80,000 from GM, we're going to get, you know, 100,000 from Tesla, and whoever the other producers are. I haven't seen, we've got a master plan here and we're executing on the master plan. I know that when we were in the White House and we had to distribute the money for as part of the Rebuilding Act, the ERA Act, I remember every morning at OMB, every morning we had a rundown list of where's the money going, where are the bottlenecks, what can we do to unlock the bottlenecks. Every day we had that full list going. And Peter Orszag, who was my boss, you know, took down the 3 or 4 major bottlenecks that day and made calls to make sure that they were relieved. I don't know. I just don't see that. Maybe it's happening behind the scenes. It doesn't seem to be, but that's the kind of you know, leadership you really need, and you need it every day, and you need good people working, knowing who to call, where the bottlenecks are, and getting someone in real authority to unlock those bottlenecks. Did I lose you?
Thanks for bearing with us. My mic went down, but I did get to hear everything Dr. Emanuel said, and it sounds like the Trump White House did too. Ashley Parker, the Defense Production Act will be used by this president specifically for the purpose of making more ventilators. You have some reporting on that?
Yeah, so the president initially did not want to actually implement it. He kind of said himself, he talked about it a bit the way Dr. Emanuel did, as a point of silent leverage. And he was getting a lot of pushback from actual conservatives in his administration and in his ear, saying, if you do this, this is exactly what we don't like. It's big government. It opens you up to charges of socialism. And then there was a lot of pressure publicly. You were seeing doctors and nurses and medical workers on the front lines posting basically anywhere they could to try to get the government's attention and saying, we don't have the ventilators we need. I mean, you also had Governor Cuomo saying that we don't have the protective equipment we need. The photos of the nurses, you know, that just shake you wearing trash bags and trying to treat patients. So he was kind of getting pressure from both sides. And it looks like today, because GM was not doing what he wanted, he has finally decided to implement the Defense Production Act.
And Ashley Parker, it has all the hallmarks of a Trumpian vacillation between trying to bully companies into making these things, going on his favorite network, getting himself some political cover by saying that Cuomo's number is exaggerated, there's no way we'll need it, and then under another day of withering bipartisan criticism about shortages of supplies as this pandemic starts its spread, unfortunately, across the country, he gives in. Any reporting on who was influential in this ultimate decision?
Not specifically in this decision, but you are right about these tension points, right? And one thing we've reported on is that the president, again, there's this uneasy tug of war between him, the scientists in his administration, the public health experts in his administration, the medical professionals, and then sort of the economists in his administration, the Mnuchins and the Kudlows, and these guys, these Chamber of Commerce types, these Wall Street guys on the outside who he's hearing from. And you have people saying, you know, you absolutely have to basically shut down the country to flatten the curve. And this isn't quite shutting down the country, but these are one of these measures that he's reluctant to take, but that is in the interest of public health. And then you have other people saying, well, wait a minute, public health includes economic health, right? And what happens to someone's mental health if they lose their entire 401k, if they can't go back to work, if a restaurant has to utterly shut down? And, you know, someone told me at the end of the day, the president is a business guy. He always comes back to those economic concerns. And in a certain way, I think that squares with the Defense Production Act, because one of his frustrations with GM, as he said publicly and has been reported, was he felt the price tag was too high. He felt they were acting too slow. And this finally was what he felt forced to do to push them into action.
Ashley Parker, a lot's been made about the different tone. Yesterday's briefing called the Easter reopening aspirational. Any sense of whether that displeased the president or whether they are simply coexisting with the understanding that their roles are very different?
I would say, Nicole, they are coexisting uneasily. Anthony Fauci still has a lot of clout in the White House. The president has told people that he thinks Fauci and Deborah Birx, they have impeccable credentials. There is something of an understanding that whether he likes them or not, he needs these people here now. He can't simply jettison them because they get too much media attention or they say something he doesn't like. But there is a real uneasy push and pull between them. And you see Fauci kind of trying to square that publicly in real time. He is gently contradicting the president almost every day from the podium. But the way Fauci tries to couch it is, look, I'm a scientist. I come from this from a scientific standpoint. And the president is coming from a place of hope. So, for instance, a lot of people have said when the president suggests the use of drugs that have in no way been proven to be effective treating the coronavirus, that is dangerous. And Fauci tries to put the most positive spin on it, which is, look, if the president can give the American people a bit of hope that we might be able to get the country reopened or that we might one day find a cure, that's not the worst thing in the world. And the reason I am here as the doctor is to explain hope is one thing, but there have to be clinical trials. There has to be scientific evidence. And that's kind of where they stand right now.
Dr. Emanuel, what concerns do you have about Donald Trump's now publicly announced plan to start reopening the country's economy county by county? I've read every news story, and it doesn't seem that this is a pandemic that sees county lines.
No, it's not a pandemic that adheres to county lines, but I think the idea that there are some parts of the country that have low levels of infection, and you can do testing and contact tracing and contain the virus is probably not unreasonable. There may be places, people have said Nebraska, where you can actually do this. But remember, that requires a certain kind of infrastructure, testing infrastructure. Maybe we have a low count in Nebraska of coronavirus cases because we haven't tested and we don't have the contact tracing and containment capacity. So if you're going to do that and you're going to actually act on those green counties that have a low level, you need to have a kind of public health infrastructure in place. That's one reason that I've called for a nationwide shelter in place, quarantine, whatever you want to call it. And then we can begin opening up. And maybe there are places, the equivalent China is they shut down Hubei, but they kept other cities open. You can then open up some of these places, assuming they have the right infrastructure. Let me make one other point, which I was recently reading a Federal Reserve analysis of the 1918 flu pandemic comparing those cities that put economics first and let's get everyone back to work and not do the public health stuff, with other cities that actually did the public health interventions and tried to reduce the spread of the virus. And they looked at what was the subsequent economic growth in those two cities. And it turned out that the cities that did the public health measures actually after the 1918 influenza pandemic had better economic growth. So if your primary goal is we've got to get the economy moving, the way to do that is to do the public health measures first and then to slowly release them. That's actually going to lead to longer, a sharper upswing in the economy after the virus has gotten under control. That's at least what the data from 1918 show. And I think it might be persuasive. It's at least a piece of evidence that the president might listen to as to why we need the public health measures first and not go for, crazy Easter. That just makes no sense from any perspective.
It is so interesting. To achieve his goals, taking care of the health crisis first would certainly seem to be the straightest distance between those 2 points. Ashley Parker and Dr. Zeke Emanuel, thank you both for spending some time with us. We're grateful. Thanks for bearing with us through our technical glitches.
Stay healthy.
We should also mention that Dr. Emanuel will... Thank you. We should mention Dr. Emanuel will be here Monday night with our colleague Lawrence O'Donnell for a primetime special, Life in the Time of Coronavirus. It's an in-depth look at the science that should be guiding us all through this pandemic. That's Monday night at 10 p.m. When we come back, we speak to members of Congress from New York, the epicenter, where healthcare workers and hospitals are bearing the brunt of the region's response and paying with their own health and their own lives. Also ahead, the Trump administration has to navigate Donald Trump's freewheeling and confusing public pronouncements as they seek to impart life-saving information to the public, but they're also hampered by an unprecedented number of vacancies in the agencies that typically respond to public health crises. We'll bring you the latest reporting on that front, and Donald Trump not letting a national emergency get in the way of a good gripe, how he's attacking governors, all those stories coming up.
FEMA and the Army Corps and the National Guard have been working to put up these emergency hospitals. So far, we have planned for 4. Again, with all of these beds, we still have a shortfall. So we're going to go to Plan B. What's Plan B? We're going to seek to build another 4 temporary emergency hospitals, which would get us another 4,000 beds.
New York Governor Andrew Cuomo trying to help the increasingly dire situation New York City is facing right now. Its hospitals and healthcare systems already inundated with coronavirus patients, and it seems there are only more on the way. That problem spelled out in heartbreaking terms in a New York Times piece on a hospital in Brooklyn and how it is frighteningly close already to reaching its breaking point. Quote, I have so many different fears, Dr. D'Souza, who chairs the emergency department at the Brooklyn Hospital Center, said on Wednesday. If the patient volume increases at the current pace, She's concerned the emergency room will be out of space by next week. If many patients are desperately ill and need life support, she worries about having to choose between them. Governor Cuomo also gave an updated total of cases in the state. More than 44,000 confirmed positive. In the last 24 hours saw a spike in the number of deaths, 519, up from 385 yesterday. Among those tragic deaths, a nurse manager from a Manhattan hospital whose death his coworkers are blaming on a lack of protective gear. Quote, a nurse who worked with Mr. Kelly said the hospital had offered nurses one plastic protective gown for an entire shift, though normal protocol required a change of gowns between interactions with patients. The nurse said Mr. Kelly had not used protective equipment, even though he regularly helped nurses on his team with hands-on care. Joining us now, Congressman Greg Meeks and Max Rose, both Democrats representing the great state of New York. Congressman Rose, I've been following all of your updates on Twitter. I know you're very concerned, I know you both are, about first responders. Tell me what's being done and what more needs to be done.
Absolutely. So let's group for a moment first responders as well as our nurses and our doctors. These are the frontline soldiers. The frontline soldiers in this new war that we're fighting. It's not a war against an army. It is a war against a virus. And we need, just as we saw in World War II, we need an all-hands-on-deck approach, a mobilization that includes all segments of society, and we have got to do it today. We have people dying each and every day in our communities in New York City, and we cannot allow for a slow evolution. We can't allow for the federal government to slowly wake up to this crisis. This involves the state, the city, as well as the president. What we see Governor Cuomo doing each and every day, we need that type of plan nationwide, because this crisis will move on from New York City, and it will move on somewhere else. And when that does happen, we can shift those resources there. But right now, we need the eyes of the nation and the resources of the nation on New York City.
Congressman Meeks, your thoughts? I mean, New York has been through so much. We've been through the 9/11 attacks. Our hospital workers don't scare easily. Our first responders don't scare. But this is a virus taking a toll on our police department, our fire department, and now, based on these two new reports, our frontline healthcare workers.
Yeah, this is absolutely something completely different. I was here during 9/11, and that was another catastrophic event, but it was an event where we urged people to get back on the streets so that we can continue our way of life. Here is just as different, and this is a long-term fight, a long-term war against this virus, as Max Rose just indicated. And what we've got to make sure, what our governor is trying to do, what our mayor is trying to do, is not only look at where we are right now, but look at where we will be in a week or in 2 weeks. And that's why we need every resource to come into the city, into the state right now. And we need the president to step up. We need to make sure that he's calling, if he can get additional people to manufacture more of the PPEs that is necessary. We need to do it because the lives are at the line. And when you look at those who are in the front, those doctors, those nurses, those individuals who are the EMS workers, they are all in jeopardy, and there's no way. They're heroes. They're putting their lives on the line, and we are the richest country in the world. We should make sure they have every piece of equipment that they need, and we need to get it now, and we need to make sure it's in abundance so that we'll be ready not only right now, but a week from now, 2 weeks from now, because that's when we believe the peak will happen here in the city of New York.
Congressman Rose, this was written about you in Politico this week. Representative Max Rose has turned his home in New York City into a one-man war room amid the epicenter of the national outbreak. Over the past week, the freshman Democrat helped secure New York City's first testing site in his district and pushed the White House and state officials to speed up procedural steps, such as approval from the Food and Drug Administration. We are building the plane as we fly it, Rose said. Why are we doing all this mid-pandemic? Why wasn't more of this done ahead of time?
Well, there certainly were preparations that could have been taken. But with that being said, we don't have the luxury right now to look in our rearview mirror, not when we have people dying every single day, not when we have nurses and doctors on the front lines. So what needs to happen going forward? What needs to happen is we got to get that Naval Hospital into New York Harbor, 1,000 beds. We got to open up the VA to non-veteran patients. And we have to assert all of the president's power over the production of ventilators and PPE, because right now there's a global war going on for these supplies. And they're not, these private manufacturers aren't thinking about the cities that need it most, the states that need it most. They're just thinking about who can pay the most. It's only the president that can step in, use public funds to build new factories, use his authority to mandate what these private manufacturers do. I am heartened to hear that he is now deciding to do it. But we have got to move quickly, because in New York City, there's a fierce sense of urgency. Everything has to be done. We cannot express that enough. It's easy to stand up here and say this. What's hard is what our nurses and our doctors and our first responders are going through right now. They are waging war. They're soldiers, and we have got to be there for them, just like we're there for soldiers deployed overseas.
Congressman Meeks, I know you, both of you went to New York, I believe, to vote on the Relief Act, the bill that the president is signing today. We'll have that footage in a couple minutes for our viewers. Did it do enough for New York? I know the governor doesn't think so.
Well, we need to do more, but we did do, our jobs. We've got about, I think, over $50 billion into the state, putting the money into the hands of the average worker, trying to make sure that more money in unemployment, more money for hospitals, more money for PPEs. But I understand the governor's problem is that we need even more, because when you look at the money that should be going to the state so that they can make sure that they close their budget, because they are spending so much more money in this emergency, that they need more than the $5 billion that they got out of it. And the city got $1.2 billion. So we need more money. There need to be more resources, because if you look at the proportion of what's taking place right now, here in New York City is where we are the epicenter of this war. And so we need all of the resources to go to New York at this point. So we need more money, and we will need more. I think there's going to be a fourth bill that comes through, and we've got to make sure that we take care of the state of New York and the city of New York in their for their structural relief, and to be able to close their budget gaps.
Congressman Rose, let me give you the last word. You are both forces of nature, and there are things that you're doing that all New Yorkers are grateful for. But you talk about a war. Everyone has been enlisted. We've been asked to do our part to shelter in place, and a lot of people feel isolated and afraid. What do you say to them?
Well, what I say to them is that we're the greatest country in the history of the world. New York City, greatest city in the history of the world. We will get through this. We will rise to the challenge. What I was really heartened by to see today is that this was not a Democrat or Republican stimulus bill that we put forth. And just as this virus doesn't see Democrats or Republicans, it doesn't see race, creed, religion, socioeconomic status, we are uniting as Americans to take this on. But we have so much work left to be done. But we have the best and the brightest people tackling it each and every day. These nurses, these first responders, these doctors, the heroes that they are doing unbelievable things. And we have got to have their backs, because if we don't support them, I don't care how many ventilators you have. I don't care how many hospital beds you have. I don't care how much PPE you have. We will not be able to save people's lives. We have got to be there for them, and we will.
Thank you both for your service. Congressman Greg Meeks, Congressman Max Rose. Thank you so much for spending some time with us. After the break, it used to be a punchline, the record-level turnover in top positions at the White House. But in the midst of a crisis, it's turning out to be anything but. How top vacancies are affecting the fight against coronavirus. That's next.
We think we have it very well under control. We have very little problem in this country at this moment, 5. And those people are all recuperating successfully. What do you have, a very small number of people in the country right now with it? It's like around 12. Many of them are getting better. Some are fully recovered already. So we're in very good shape. Because of all we've done, the risk to the American people remains very low. When you have 15 people, and the 15 within a couple of days is going to be down to close to zero, that's a pretty good job we've done.
He will truly say anything, but if only he'd been right with those predictions. The front page of the New York Times today shows the devastation across this country since the virus first gripped the nation. Above the fold, as has been the case most days since the coronavirus outbreak started to alter every aspect of American life and cut short the lives of hundreds of Americans. A story centered on presidential accountability, a president who has bragged about the vacancies and the number of acting officials in his administration has been caught woefully unprepared to address this public health crisis unfolding on his watch. According to the Times, some 80% of the senior positions in the White House below the cabinet level have turned over during Mr. Trump's administration, with about 500 people having departed since inauguration. Mr. Trump is on his 4th chief of staff, his 4th national security advisor, and his 5th Secretary of the Department of Homeland Security. The Times writes this, quote, ever since President Trump came into office, a record high turnover and unfilled jobs have emptied offices across wide sections of the federal bureaucracy. Now, current and former administration officials and disaster experts say the coronavirus has exposed those failings as never before and left parts of the federal government unprepared and ill-equipped for what may be the largest public health crisis in a century. Let's bring into our conversation Associate Editor for Real Clear Politics, my friend A.B. Stoddard, and Chair of the Center for African American Studies at Princeton University, my friend Eddie Glaude. Eddie, to you first.
You know, it's a combination of three things, Nicole. It's ignorance, it's incompetence, and it's ideology. We can attribute, I mean, it's pretty straightforward where Trump just simply doesn't know what he's talking about. We really want him to be quiet at times. The incompetence has everything to do with the turnover, right? The fact that we're not dealing with the B team or the C team. We're actually the D and the E and the F team. That a lot of folk don't want to risk their careers working for Donald Trump. They don't want to be associated with this administration for some various obvious reasons. But then there's the ideological part of it. We have been dealing with, and you know this, Nicole, for about 40 years with a view of big government as in some ways the source of evil, a big government as the problem, right? That we don't really need Big Brother. And even with Donald Trump, remember Steve Bannon said we want to deconstruct the administrative state. So there's been a kind of deliberate ideological position to in some ways deconstruct the federal government, to view the bureaucracy of the federal government with deep suspicion. And here we are in a moment where we need the federal government very clearly, and we are not simply prepared.
You know, AB, the person who needs the bureaucracy to perform the most is Donald Trump. He has the most riding on this pandemic being contained, on it not spreading, on the economy coming back. And so it's mind-boggling that he doesn't listen to the experts. You've got an open letter out to President George W. Bush and Barack Obama. Talk about that.
Well, I think, Nicole, it's time for some people who have the same level of influence as the president or more. Voices that Americans would trust, a bipartisan effort to come forward and really just be blunt with the American people. There is no plan. If there had been a plan, we wouldn't be seeing the pace of infection that we're seeing. We wouldn't be seeing the numbers, the data, all of the panic across the healthcare system, which is at the precipice of breaking. There wasn't a plan. All of the vacancies and the hollowing out of the appropriate agencies that you just cited, combined with the president's willful negligence and sort of refusal to acknowledge the need for testing, the need to acknowledge and isolate the infection rate, that's just something he lost us 6 critical weeks on. And so I'm calling on the former presidents to do what they don't want to do, which is to come forward together and say, this is really a moment where we could see damage not only in the short term, but for generations, for decades to come, to this economy, to the healthcare system, and to our citizens if we don't make a plan right now. And as we all know, even those of us who are not doctors, the plan involves a lockdown, a national lockdown, building Bill Gates last night said 10 weeks, or across-the-board testing throughout the entire nation that allows us to isolate the infected so that we can send the recovered who are no longer contagious or won't get reinfected again back to work. But the idea that he would open sections of the country in several days and say that they're low risk is out of the question. I mean, look at Governor DeWine of Ohio, a Republican, who's been one of the leading governors in this effort. He's tweeting today about how it's coming. If it isn't in your community, it's because you just don't know it. And it's everywhere. And so I'm just waiting in these 5 o'clock pressers every day when he says we're doing a terrific job for someone with a bigger foot to step in. And I'm asking the former presidents to break their silence and try to take on this, tackle this responsibility.
You know, Eddie Glaude, Donald Trump was asked almost exactly 1 week ago, it was last Sunday night, if he'd reached out to any of the living presidents to ask for their advice. And he said, no, there's nothing they could teach me. What is it, in your view, that hinders the country's effort to save lives, to respond to surge resources in the most alarming way? Is it that sense that he alone can fix things, which is something he said out loud? Is it that he can never remove himself from these briefings where people do? I watch them all as well, and I watch them the way AB does, hoping that everything we've observed over the last 3-4 years of covering Trump was wrong, that he actually is big-hearted, that he actually does care about red states and blue states equally. And I have not seen any scrap that we've been wrong.
Well, you know, Nicole, I think that's in part the issue. He alone can fix it. We've heard that before. We know the nature of his arrogance and how it in some ways serves as a cover for his ignorance. But I think it's also the way in which a kind of American exceptionalism works, that we think that we are in some ways invincible as a country, that sometimes we don't want to look the facts squarely in the face of what we're confronting and what we have done to make ourselves vulnerable. It's something else, Nicole, when we look at what the underbelly of American society is. It is being exposed. The coronavirus is exposing years of neglect of the public health infrastructure, years of neglect of the poor. It's exposing those folks who are vulnerable in prisons and in jails across the country. So in some ways, what we have to do in this moment, not just simply call forth former presidents to come forward, because we need them too. We also need to confront what we have done to bring ourselves to this moment in order to open ourselves up to being otherwise. Trump is clearly who he is. We know who he is. We've known for a while. But we have to also understand what we have done in order to bring us to this moment.
A.B. Stoddard, I should point out that as we've been talking, the president has signed the latest stimulus and relief package. It was passed with bipartisan support, but the president celebrated only with Republicans. Does that send an even clearer sign of how he's viewing all of his actions in the coronavirus response?
Well, Nicole, the fact that the president has broken a ceiling in his polling for the first time is in his entire campaign of 2015 and 2016 and his entire presidency is affirming for him, and it makes him believe that his response to the coronavirus, those critical 6 weeks I cited that we lost, that will lead to untold economic destruction and more sickness and death and more trampling of our healthcare system. This polling is everything he needs to hear, that he is doing the great job that he is telling us each day at those briefings he's doing. He has never been interested in persuading the voters who didn't support him. He's only interested in winning re-election by mobilizing his own supporters. And he has no problem not going to the St. Patrick's Day lunch at the Capitol, a bipartisan event. He has no problem canceling appearances with Nancy Pelosi from now on and only appearing with Republicans. He's kind of made his bed, and he's pretty content lying in it. And I think that those polls is good. Really, I mean, all he's waited for is this kind of polling throughout his presidency. And I think it's going to embolden him to be more partisan, but also to believe that the things he's telling us about the coronavirus and the administration's response are true and effective.
A.B. Stoddard, Eddie Glaude, it's wonderful to see your faces. I can't wait for the day when we're all around the same table together again. After the break, how our nation's governors are stepping in to fill a void of leadership and what they're doing to stop the virus.
We have people like Governor Inslee. He should be doing more. He shouldn't be relying on the federal government. Governor Inslee, that's the state of Washington. He was a failed presidential candidate, and you know he's always complaining. Your governor of Michigan, I mean, she's not stepping up. I don't know if she knows what's going on, but all she does is sit there and blame the federal government. Some of these governors, you know, they take, and then they complain. They take, and you do a great job. You build them a hospital. You do other than that, they're always complaining. So I don't like that.
Even in a time of crisis where his leadership has been questioned, Donald Trump still finding ample time to air his personal grievances on cable television. And speaking of governors, my next guest is working to protect his state, already hit hard by coronavirus. There are now 8,800 confirmed cases in New Jersey and more than 100 deaths. Joining us now, New Jersey Governor Phil Murphy. Governor, how are you doing? How's your state doing?
We're holding up, Nicole. New Jersey is as tough as nails. We will get through this, but this is a war. And you rightfully point out almost 9,000 positive cases, but far more importantly, 108 lost lives. And those numbers are overwhelmingly certain to go up a lot more than before they come down. But, you know, we're a tough state. We're one big family. And if we do, each of us do their part, we're going to get through this.
Your predecessor, Chris Christie, famously and to his political detriment, worked with Democratic President Barack Obama. Do you see any prospect for history repeating itself? Are there open lines of communication that we don't see when Donald Trump goes on Fox News and attacks seemingly Democratic governors?
Yeah, I haven't seen him on MSNBC here in a while, so I can assume it's another network. But listen, we have one president. You know, I don't get to wake up in the morning and pick President X or Y. The president's Donald Trump. The vice president's Mike Pence. And we have to find ways to find common ground and work together. And we do, in fairness. I mean, we need a lot more personal protective equipment. We've gotten a fraction of what we need. But I have to say at the same time, the president approved 4 pop-up field hospitals, the first one of which is being put up as we speak. FEMA has come in to help us on 2 drive-through testing sites. We got to find common ground right now. This is way beyond partisanship, and I frankly don't care about any political price any of us have to pay for that. This is what we need to do to keep people alive and keep them safe and get through this as fast as possible.
Do you think there's any prospect of I'm a New Yorker, and I know that New Jersey, like New York, I think it's been described as our weakness being our strength, the fact that we live so densely. Do you think there's any prospect of any social distancing requirement being lifted in your state by Easter?
Listen, Nicole, if that were the case, I'd be the happiest guy in New Jersey, maybe America, maybe on the planet Earth. But we've been at this since January. We've been making our decisions based on data and science and the facts. And frankly, I hope I'm wrong, but the data we see, this is going to keep going up, and it's going to spill meaningfully, I'm afraid, into May. And I think we make a huge mistake. You know, the first order of business is to flatten the curve and break the back of the coronavirus. Then secondly, responsibly begin to open up the economy and our society. I think if we transpose those and we do one before the other, I think we run the risk of throwing gasoline on the fire, and we just can't afford to do that.
Governor Murphy, grateful to have a chance to talk to you. Thank you for spending some time with us. Another short break for us. Chuck Todd picks up our coverage after this. Thank you for watching.